Welcome to Seismofit, the easiest and fastest way to accurately estimate VO2 max. Seismofit utilizes seismocardiography, a technology that captures and analyzes the subtle vibrations produced by the beating heart. This non-invasive method provides a detailed assessment of cardiorespiratory fitness in just minutes. Cardiorespiratory fitness, and by extension VO2 max, is recognized by the American Heart Association as one of the best indicators of cardiac function and overall fitness and health. Applying Seismofit is quick and easy. The sensor is attached to the patient's chest using a double adhesive patch, ensuring comfort and accurate data collection. Make sure the head symbol on the sensor is pointed towards the head of the patient. The Seismofit app guides users through the testing process. Simply select the sensor, making sure the SN number corresponds with your sensor. Ensure proper placement to achieve accurate results. Input the patient's information: weight, height, age, and gender. Once the sensor is in place, ask the patient to lay down, relax. Do not speak and breathe normally. Then start the recording. The measurement only takes 40 seconds. A countdown shows time remaining. The app then displays the VO2 max value on the screen and can also generate a PDF report that can easily be stored and shared. The whole process takes less than 3 minutes.